Dr. Fauci, the quick development of effective COVID vaccines has been a real success story during this pandemic. People are getting vaccinated is really key to everyone's ability to return to normal lives. With the spread of variants, as we all talked about, driving increases in cases and deaths now, I'm encouraged to see public health experts and vaccine developers are now considering the possible need for boosters. You mentioned this a bit in your opening remarks, but I wanted to ask you, how do you assess the duration of vaccine efficacy and the impact of variants on that efficacy?
Thank you very much, Madam Chair.
Dr. Fauci, as you are aware, it is a crime to lie to Congress. Section 1001 of the U.S. Criminal Code creates a felony and a 5-year penalty for lying to Congress. On your last trip to our committee on May 11th, you stated that the NIH has not ever and does not now fund gain-of-function research in the Wuhan Institute of Virology. And yet, gain-of-function research was done entirely in the Wuhan Institute by Dr. Shi and was funded by the NIH.
Senator Smith.
Thank you, Dr. Fauci. And thanks to all of our panelists for being here today. And thank you, Chair Murray and Ranking Member Burr. I just want to say, Dr. Fauci, is there anything more that you would like to say to counteract these attacks on your integrity that we've all just witnessed?
Well, Senator, thank you. I don't think I have anything further to say. This is a pattern that Senator Paul has been doing now at multiple hearings based on no reality. He keeps talking about gain of function. This has been evaluated multiple times by qualified people to not fall under the gain of function definition. I have not lied before Congress. I have never lied, certainly not before Congress. Case closed.
Thank you. So we are 16 months into this pandemic, and I think we're at a critical moment. 2/3 of adults have received at least one dose of the vaccine, and at the same time, we are seeing cases rising to about 41,000 a day. As Dr. Walensky has said, we have an epidemic here of the unvaccinated, but of course, this continues to affect every single one of us. So it seems to me that our actions and messages in this moment are going to make a huge difference in whether we move forward or backwards, not only here in the United States, but everywhere in the world. You know, today, as I was walking into this committee hearing, for the first time in months, I saw a line of people waiting outside of a pharmacy for testing and vaccines. And it made me wonder whether the recent surge of the Delta variant is getting people's attention and moving them from indecision to action. What a terrible way for this to happen. So I have a few questions just to, I hope, clear up some of the misinformation and misunderstandings. Dr. Fauci, the COVID-19 vaccine protects against the Delta variant. Is that correct?
Dr. Fauci, knowing that it is a crime to lie to Congress, do you wish to retract your statement of May 11th where you claimed that the NIH never funded gain-of-function research in Wuhan?
Senator Paul, I have never lied before the Congress.
Microphone.
Your microphone.
Senator Paul, I have never lied before the Congress, and I do not retract that statement. This paper that you are referring to was judged by qualified staff up and down the chain as not being gain of function.
So
let me finish.
You take an animal virus and you increase its transmissibility to humans,
right.
You're saying that's not gain of function?
Yeah, that is correct. And Senator Paul, you do not know what you are talking about, quite frankly. And I want to say that officially. You do not know what you are talking about. Okay, you get one person.
Let's read from the NIH.
Can I?
Some of the recent research is showing that COVID-19 vaccine may actually improve symptoms for some patients with long-haul COVID. So, Dr. Fauci, what do we know about this so far, and how common is the vaccine to be a strong prevention tool, but also to work therapeutically in this case? And what else should we be studying?
Very good point, Senator.
This is your definition that you guys wrote. It says that scientific research that increases the transmissibility among mammals is gain of function. They took animal viruses that only occur in animals, and they increased their transmissibility to humans. How you can say that is not gain of function?
It is not.
It's a dance, and you're dancing around this because you're trying to obscure responsibility for 4 million people dying around the world from a pandemic.
And let's let Dr. Fauci.
I have to, well, now you're getting into something. If the point that you are making is that the grant that was funded as a sub-award from EcoHealth to Wuhan created SARS-CoV-2, that's where you are getting. Let me finish.
We don't know.
Well,
we don't
wait
know
a minute.
if it did
I
come
can-
from the lab, but all the evidence is pointing that it came from the lab, and there will be responsibility for those who funded the lab, including yourself.
I totally
This committee
resent,
will allow the witness to respond.
I totally resent the lie that you are now propagating, Senator, because if you look at the viruses that were used in the experiments, that were given in the annual reports, that were published in the literature, it is molecularly impossible.
No one's saying those viruses caused it. No one is alleging that those viruses caused the pandemic. What we're alleging is that gain-of-function research was going on in that lab, and NIH funded it.
That is
you can't
not-
get away from it. It meets your definition, and you are obfuscating the truth.
Dr. Fauci, I have a question for you about pediatric vaccines. Many parents and family members are understandably eager for updates on the potential availability of COVID-19 vaccine authorized for use for children under 12. I'm encouraged that clinical trials for young children are underway, and I'm hopeful that we will see the same safety and efficacy that we've seen from previously authorized COVID-19 vaccines. Doctor, when do you believe parents and families can expect trials to yield the type of data needed to pursue authorization for use in children under 12?
Thank you for that question, Senator. I'm
Senator
not
Paul,
obfuscating the truth.
Senator
You are the
Paul's
one.
time is expired, but I will allow the witness to.
Let me just finish. I want everyone to understand that if you look at those viruses, and that's judged by qualified virologists and evolutionary biologists, those viruses are molecularly impossible
No one's
to
saying
result
they are. No
in
one's saying those viruses
SARS-CoV-2.
caused the pandemic.
Senator Paul,
We're saying they are gain-of-function viruses because they were
they're not.
animal viruses that became more transmissible in human, and you funded it.
And
won't
you
admit the truth.
and you
Senator
implying
Paul, your time has expired, and I will allow witnesses who come before this committee to respond. Dr.
and you are implying that what we did was responsible for the deaths of individual. I totally resent that.
could have
And
been.
if
That it
anybody
could
is
have been.
lying here, Senator, it is you.
Senator Smith.
Dr. Fauci, in reference to the questions by Senator Paul today and the accusation, I think it's a widely shared view in both houses and both parties that the integrity that you bring to your work and the knowledge you bring to your work on behalf of the nation, I think that sentiment is a broad and deep reservoir, and it is very, very much bipartisan. I won't ask you to comment on that. But I have a question for Dr. Fauci and Dr. Walensky about breakthrough infections.